The Barangay Integrated Development Approach for Nutrition Improvement Network Program remains to be one of the leading initiatives in nutrition and development in the Philippines. For over 40 years, BIDANI continues to strive in advocating for the vital role of nutrition and rural development at the grassroots level, at various levels of governance and the academe. BIDANI traces its roots from the year 1978 when it started as the Nutrition Improvement Model or NIM. As a research project in UPLB, it was conceptualized to eradicate malnutrition among Filipino people. Emerging from the successes of the model, the name was transformed into what we now know as BIDANI in 1984. By 1985, BIDANI spread its wings into other state universities and colleges. It spearheaded collaboration of SUCs, which UPLB trained to replicate the BIDANI strategy. From then, 7 SUC members took part in forming the BIDANI Network Program, namely its national coordinator, the University of the Philippines Los Baños, Central Luzon State University, Isabela State University, Bicol University, then Visayas State College of Agriculture, and now Visayas State University, and Central Mindanao University. The University of the Philippines Visayas joined the network in 1990. These SUCs, then called BIDANI Network Mother SUCs, trained other universities and academic institutions in their nearby areas. Realizing the potential of multi-sectoral efforts in identifying sustainable solutions and strategies for nutritional improvement, BIDANI amplifies coordinated capacity building among agents of society from local to international agencies. As of 2024, BIDANI's coverage expands into 687 barangays located in 29 municipalities and 5 cities in 11 provinces in 7 regions across the Philippines. Emboldened through time, BIDANI is now renowned for its community-based, participatory, and multi-sectoral development strategy aiming to improve governance and strengthen food and nutrition security among its catchment barangays in the Philippines. BIDANI considers nutrition as the social indicator for overall development. As an integrated development approach, BIDANI also delves into different sectors of local government such as agriculture and food security, social services, livelihood and women in development, infrastructure, sports and youth development, peace and order, environmental management and disaster risk reduction management, among others. These sectors of development are integrated to achieve health and nutrition improvement, food security, and good governance for the general well-being of the community. As a strategy, BIDANI champions a systematic, comprehensive, multi-sectoral, and community-based method of planning, implementation, and evaluation of activities that operates at a bottom-up approach. All these are further strengthened through the implementation of BIDANI's 3 innovative strategies. The Barangay Integrated Development Approach, or BIDA, promotes awareness and empowers stakeholders to actively participate in development efforts as reflected from the Barangay Integrated Development Plan. It also capacitates municipal and barangay levels to develop their own strategies and approaches by providing trainings, workshops, and technical backstopping, especially during the planning process. The Barangay Management Information System, or BIMIS, facilitates the identification of essential and nutritional development needs of the barangay by establishing a community data information system. It also promotes e-governance through the BIMIS software. The BIMIS software allows for exhaustive, relevant data generation, processing, and retrieval, which will serve as basis for planning, implementation, and monitoring and evaluation of development programs. Through the BIMIS strategy, data becomes the center of decision-making and governance in the barangay. Lastly, the Participative Nutrition Enhancement Approach, or PNEA, utilizes a participative strategy in preventing malnutrition for nutrition program planning and management. Through PNEA, the Philippine Plan of Action for Nutrition is localized in the barangays through the facilitation of Barangay Nutrition Action Plan development. PNEA also promotes food production and innovative activities at the household level through the life cycle approach. The utilization and promotion of the Kalinga supplementary mix made from rice, mung bean, and sesame seeds also plays a vital part in PNEA. As a program, BIDANI functions as an action research and extension program that propagates innovative projects identified by the people in the community. Under this functionality, UPLB BIDANI plays two key roles. First, as a National Network Program Coordinator, UPLB BIDANI oversees the network of state universities implementing the BIDANI strategy nationwide. Second, as a BIDANI implementing SUC, UPLB BIDANI has its own catchment areas at selected municipalities in the province of Laguna. As of 2024, UPLB BIDANI has 80 catchment barangays under its jurisdiction. For over 45 years, the BIDANI Network Program has become a leading force in nutrition in development at the local and national levels and in the academe. We will continue to strengthen our ties with existing SUCs and will encourage more universities and colleges to adopt and institutionalize BIDANI in their respective institutions. We will not stop enhancing our innovative strategies to become more responsive to the evolving and pressing needs of the people. More importantly, our catchment barangays will be strengthened further with continuous capacity building and backstopping services as we continue the pursuit of fighting malnutrition with an integrated approach towards development. BIDANI will persistently take strides to achieve revitalized collaborations, more responsive, innovative strategies, trained and skilled members of network SUCs, and a more strengthened network of higher education institutions working together. Continuing the legacy of nutrition in development across the Philippines, we are the BIDANI Network Program.